Hi, everybody, and welcome to our last recorded lecture. And we are going to be talking about the stages of death and dying. The most famous model that investigates theoretical standpoint that investigates the stages of death and dying was developed by Dr. Elizabeth Kubler-Ross. It is called the Kubler-Ross's 5 Stages of Dying. She published her work in the late 60s. It's important to understand that prior to the publication of this work, that discussing death in American society was very taboo. It's just not something we talked about openly. It was considered morbid. So even though it's sort of staring everybody in the face that, grandma's going to die, we don't talk about it until it happens. We don't prepare for it because that was considered, it was taboo. It was rude. It was sensitive. We didn't discuss it. But when Kubler-Ross developed her stages of dying, we began a whole new dialogue around death and dying in the United States. Ultimately, she developed this identification of the 5 stages that people enter into once they find out that they're going to die, whether it's from a terminal illness or they realize that they're at the very end of their life, the very end of the aging process, and that death is imminent. Often in hindsight and after this was developed, it has been applied that the thought process is that people are supposed to go through each stage in order. However, that's not what Kubler-Ross ever intended. She never intended that the way she presented the 5 stages were, step 1, step 2, step 3, step 4, step 5. And actually what she thought is that people can go through any of these stages in any order, and they may go through some but not others. Whereas for many years it was taught that they must go through these stages in order, and they go through all 5. But after the fact, she came out and said, that's not what I ever intended. Some people experience 3 of the 5, some people experience 2 of the 5, some people experience all 5, some people experience it in the order that I presented it, and some people don't. That it's very individualistic. This is not rigid, and it doesn't have to be in this very structured order that I presented it in. It's often represented as an acronym, DABDA, and each letter of DABDA, D-A-B-D-A, stands for the first letter of the word in each stage. So we're going to start with the first D, and that's denial. And denial is a common response and defense mechanism that people demonstrate when they've been given a terminal illness or when they are at the end of their life, and they have been told that you have just a short period of time before you pass. People engage in denial, and they think, that can't be right, that can't be true. The doctor must be incorrect. We need a second opinion. It must be a faulty diagnosis. You don't know what you're talking about. And all of this comes about because it's just very hard for people to stare their own mortality in the face. It's very hard to recognize this is it. You've been here for however long you've been here, and this is it. This is the end. It's really, really difficult to make your peace with that. It's really difficult to mentally digest that and to really wrap your brain around, that your whole existence is coming to an end. In some cases, it may come from a lack of understanding, but in most cases, it doesn't. This is just a very normal response. It's a normal response that is sometimes complicated by the fact that sometimes, in fact, doctors do get diagnoses wrong, and that you may have more time than they thought you did, or that they diagnose you with a terminal illness erroneously. Unfortunately, that happens. It's rare, but it does happen, which obviously complicates this stage of death and dying, because it's a normal thing to do that, even if it is very accurate, the diagnosis, even if it's something that's very obvious to everyone else, the person that receives that information has a hard time coming to terms with it. If somebody's having a hard time coming to terms with it and they're in the stage of denial, you don't want to argue them about it. You don't want to argue them into submission. They need to come to that realization on their own, and they will in time. They need some time to process what's happening and what this means, right? This isn't something that we can all mentally digest overnight. It's going to take a minute. So you don't want to bully them into submission and yes, you are dying, right? Let them come to it on their own. As so long as there's no confusion about the diagnosis. That's the only thing you want to be a little worried about is do they legitimately understand what we're talking about with diagnosis? And as long as they cognitively do understand that, they need to work through denial on their own. You don't want to argue with them about it. And as a doctor, you don't want to keep, battling them on, no, yes, you're definitely going to die. People get through this stage. The next stage in the process, as it was authored, is anger. once people make their way through denial and they finally realize, okay, this isn't a false diagnosis, this is happening, this is real. It's very common for patients to experience anger, even if they don't experience denial, even if right out the door they have an understanding of what this means and they're not denying it. Anger is a very common reaction. It's a very normal reaction. It's a normal reaction to having a terminal illness. It's a normal reaction to realizing that this is it, this is the end of your life. People often will lash out during this stage. And that lashing out can manifest itself in a multitude of ways, whether it's lashing out at the medical care providers, who need to be understanding of the context that this person is going through the stages of death and dying. Anger is normal. It's not personal. It's not a personal attack. It is a part of the process of making your way through this last stage of life. So if you are a medical provider, you need to understand that this is not a personal attack and it's not meant to be hurtful. It just is. It's something you should have compassion for rather than frustration with or anger with. But it can also manifest in other ways. It doesn't have to be lashing out at medical providers. It can just be getting very short-tempered, generally speaking, and being more combative and more difficult than usual, just with everybody, with medical providers, with family, with friends, because it's agitating being told that your time on this earth is limited and that you're going to die soon. So people who are around people who are going through these stages of dying and death and grief need to recognize it and, give people a little bit more of a wider berth than you usually would. Try not to take it personally, try not to be hurt by it, and certainly try not to lash back because they're going through something really overwhelming. The next stage that they go over is bargaining. Excuse me. Typically, people who are in the bargaining stage, excuse me, are seeking to find some level of control over their illness. It's a very wild thing, and you feel like you've lost complete control when someone tells you that your life is ending, and there's nothing you can do about it, right? You don't have any control. It's not like all of a sudden you can finally say, well, I'm finally going to change my diet and get healthy, right? That ship has sailed, so you have very little control, and people engage in what is called bargaining, right? And they start trying to, bargain with a higher power, whatever God you believe in or whatever religion you adhere to, that God, if I quit smoking today, I will quit smoking in exchange for you to let me live, right? If you let me survive this lung cancer, I will never have another cigarette. Well, that's bargaining, and obviously it's too late for that, right? Oftentimes, it represents almost sort of like what we call a magical thinking, right? That if I just do A, then this terminal diagnosis B will go away. And that's just not how things work. But it's a common reaction. It's a common reaction among people who are terminal and at the end of their lives, or people who've been given a terminal diagnosis. It may mobilize more active participation from the individual. They may say, well, look, I'll do whatever you tell me to do. Finally, doctor, you tell me what to do and I will do it. I will do it to a T, right? They may get more active in their healthcare. But you want to be sure, especially healthcare providers want to make sure that you're not misleading patients, that you are not feeding into the magical thinking that, yes, by doing this, it's going to go away, that your terminal diagnosis is just going to go away. That we have to recognize what's happening and recognize this stage of death and dying without feeding into that idea of that magical thinking. Again, you don't have to argue them into submission. And you don't need to argue with them about being irrational or anything like that. But you do want to make sure that you don't feed into the process as well. The next stage is depression. And this is obviously an understandable stage. Coming to terms with the end of your life is very hard, regardless of what age you are. I think people who come to a natural end, who live many, many decades, have an easier time with this, and they maybe experience a little less depression. But certainly people with terminal illnesses who are having their lives cut short, and people who are older all the time, they all experience depression. It's sad. It's sad that your life is ending. It's sad that this is it. It's over. And people start reflecting on their lives and they start thinking about, what are the things that I wanted to do that I didn't do? Or what are the things that I did, but I did it wrong, right? What are my regrets and the things that right now I don't feel good about, and there's no time for me to go and do them and fix them, right? Sadness and fatigue are common. And it's argued that there's three other stages that we talked about: the denial, the bargaining, the anger are all methods of trying to stave off this stage, and that stage is depression. That when you're engaging in those other those other stages of death, it's keeping you from landing here in depression, right? And that may very well be. um, Caregivers often find this stage less emotionally taxing than they do the bargaining stage or the anger stage. But it's important to remember that these stages have more to do with anticipating the patient's experiences, and that you need to provide empathy and support. Okay, the final stage is acceptance, right? This is the final stage that Kubler-Ross identifies. Like I said, not everybody's going to go through all 5 stages. Maybe there's somebody out there who they don't do the first 4 stages and they jump straight to acceptance. That's totally possible. That happens. But acceptance is describing accepting the reality that, okay, this is it. I'm terminal. This is how much time I have left. I'm not going to get better. In fact, I'm probably going to get worse, and my life is going to end, right? You're no longer angry. You're no longer struggling against the diagnosis or pushing back on the diagnosis. And people at this stage start to say, okay, how much time do I have left, and what do I want to do with it? Right? What do I want to do with the time I have left? They will frequently reflect on their lives, go through memories. Oftentimes they will get very practical, and they will start the practical logistical end of planning for end of life. So planning their funeral, estate planning. They might have a good pile of money left and say, you know what, well, I'm alive, I want to give this out to the people that I love. So they start taking care of logistical nuts and bolts of end of life care. Okay. Caregivers, of course, find this stage emotionally taxing, but you have to remember that it's not more healthy than any other stage. It's equally as important. Okay. And once again, all of these stages need to be met with patience, with understanding, and with empathy.